My name is Peyman Banooni. I'm going to be doing a procedure called the MyoSure procedure today. It's a procedure very similar to a hysteroscopic resection of fibroids. The main reason we do this is for women that have large fibroids or polyps that grow inside the uterus, usually causing heavy periods. They can cause anemia secondary to the heavy periods, and also they can interfere with the ability to get pregnant. Our patient today has had a good amount of anemia as a result of a 2.5 centimeter fibroid that's been growing inside the uterus. About 30% of women can have fibroids. A smaller percentage of that will have fibroids that are coming into the uterus. The ones that come into the uterus, even if they're very small, they can distort the cavity of the uterus, and therefore they can cause a significant amount of increase in their periods, and it can affect their quality of life. In the past, women would undergo hysterectomies and larger procedures in order to remove the fibroids to help their bleeding. By doing this minimally invasive procedure, it's an outpatient procedure, they can go home the same day and recover rather rapidly from it. I expect for our patient today that she would go home today, and by tomorrow she would have minimal pain. She might have minimal bleeding as a result of this, but in terms of returning back to work, she'd probably be fine to go back to work tomorrow or the next day. So I just finished the procedure. It went very well. In a short period of time, we were able to remove a rather large fibroid and some polyp tissue that was in the uterus. I expect that her bleeding will be less, and in terms of pregnancy, the uterus will be much more suitable for a successful pregnancy. This procedure, where we remove the fibroid through the vaginal area, is much more quickly done and is done as an outpatient procedure compared to the way it was done in the past, where women would have to be hospitalized. They would undergo larger procedures such as myomectomies or hysterectomies, where they would either remove the fibroids abdominally or remove the whole uterus. They would require longer hospital stays of 1 to 3 days in the hospital, and longer recovery times of 4 to 6 weeks being out of work. There would also be significantly more pain compared to the procedure that we did today. So I would advise you to see a surgeon that specializes in less invasive procedures for treatment of gynecological issues.